Mark and Dave, KEX.
Governor John Kitzhaber joins us. The Oregon House has voted to approve the governor's initiative to redesign the healthcare delivery and finance system for the Oregon Health Plan patients in hopes of improving care and lowering costs. And let's start right there, Governor. Explain how it makes healthcare better and better delivered.
Well, we're starting with the 600,000 people on the Oregon Health Plan, and essentially this changes the way healthcare is organized and delivered from sort of back-end management of acute conditions in the hospital to prevention and wellness and taking care of people with things like diabetes and congestive heart failure at home and in their communities. Much better care, much better health outcomes, much cheaper. And the idea is that if this works, and we're confident that it will, we could then use this delivery model for small businesses that are struggling to afford insurance in the small group market, and for individuals as well.
Governor, now the other piece of legislation that I know you're frustrated has not received a vote yet, and that's the healthcare exchange. Where is that? What is that? And how important is it to you?
Well, the health insurance exchange is sitting down in Ways and Means. It's ready to go. It came out of the House committee with a unanimous vote, with all Democrats and Republicans supporting it. It's important for two reasons. One, it helps us make a stronger case to the federal government for our waivers. That is, it suggests that this isn't just about the Medicaid population, but it's about changing healthcare systems throughout the state. More importantly, many small businesses simply can no longer afford health care for their employees, which is a real burden on them. And without the health insurance exchange, they're still going to have to try to buy coverage through the small group market, which is increasingly too expensive. Assuming
that what's referred to as Obamacare is upheld by courts, why is any of this necessary?
Well, this really is independent from the Affordable Care Act. That doesn't go into effect until 2014. This is basically goes sort of far beyond that act in the sense that it actually tries to change the way healthcare is organized and delivered. I mean, giving everybody insurance coverage is important, but you want to make sure that you're getting access to the right kind of delivery model. And we've got one right now that really rewards acute care and after-the-fact care and emergency room visits. We think it makes a lot more sense to actually reward the system for producing health, for avoiding hospitalizations and keeping people at home and in the community.
So very briefly, if you can, explain how it worked. Let's say somebody with diabetes, because so many Americans have it and are going to be diagnosed with it. What is the advantage for them?
Well, in many cases, they don't have consistent care at home or in the community. They end up bouncing in and out of the hospital with acute conditions, complications of diabetes. Under this system, we create incentives, a delivery system, and actually financial rewards for people helping to actually care for them at home, keep them at home, giving them a medical home, someone to actually coordinate that care, make sure they get the right care at the right time. And, the difference between, I'll give you just an example, a hospitalization for congestive heart failure might run $50,000. We believe that you can manage somebody at home for just a tiny fraction of that, keep them out of the hospital, keep them independent, and a lot healthier.
How much of healthcare going forward really has to be about prevention and healthier living and individuals being responsible for reducing obesity rates, et cetera?
It's enormous. I mean, 90% of what affects your lifetime health status has nothing to do with health care. It's issues, it's individual lifestyle choices, it's socioeconomic issues, it's things that happen at home and in the community. So by refocusing the system and the incentives on what keeps people healthy rather than how to take care of them after they're sick, not only makes sense, it's not only logical, but it is much more efficient and produces healthier people.
Well, I think everybody agrees that something's got to be done. Are you pleased thus far with the legislative session? I read one story that you're frustrated. Where are you on it?
No, I'm very optimistic. I think, we've got obviously our big issues we're trying to get through are deal with education and health care, which are very high up on the Oregon Business Plan. I had a press conference this morning with most major business organizations supporting those elements as part of our jobs and prosperity initiative. There's also another number of very good bills coming through the legislature. One increases access to capital for small businesses. One's going to allow Facebook to actually settle over in Prineville, a county that desperately needs additional jobs. So I think it's going to be a very good session at the end of the day.
The big announcement in Portland today is that Trey Arrow may run for mayor. That means that you might have to work with him on some level. You ready for that?
Well, at least I've got a little head start, so I'll begin to prepare for that eventuality.
Well, just don't meet him in his office because I don't want you to fall out of a tree.
Well, we were thinking maybe a meeting on the ledge outside the office here.
All right. Governor John Kitzhaber with Mark and Dave. Well, a landmark day. This is a big day.
The legislature's getting along.
It's kind of scary, isn't
What's
it?
that? The devil's ordering mittens.
I'm just not going to touch that one.